So now the WHO says that you shouldn't have lockdowns. It's not good in a pandemic. What is a person to do? Well, we asked Melissa Lantsman to come in. She is a well-known public advisor. You are a strategist and you're a smart woman. And so I put the question to you. Now people are saying, well, lockdowns aren't effective. What is a person in the street to do?
You would be absolutely forgiven if you actually had no idea. I think the amount of public health advice that we've been getting that has been one thing on a Wednesday and another thing on a Thursday, or different things across provinces, or different things from the federal government and from the cities, you gotta be confused about this.
You throw up your hands.
Yeah,
that's what people
absolutely.
are doing. And that's why we have so many of these sections going on, the anti-vaxxers and everything else. People are saying, herd immunity.
And here's the thing. You've got to have public trust in order to make this thing go away or flatten the curve or whatever it is that we're aiming towards.
But trust in what?
Trust in our health officials, that they're giving us the best of advice and consistent.
Oh, I'm sure they are giving us the best of their advice, but do they have the best advice?
Well, do they have consistent advice? Because that's gonna throw you off.
We know that they don't.
Do they have clear advice? No. And as a result, I think that the people are just not sure. And this is why we see what we're seeing in terms of rising numbers. We knew this was coming.
But then we're told now lockdown doesn't work.
Yeah, and I challenge the public health officials in 28 days. We're sitting in Toronto right now, and in 28 days in Toronto, what's going to change, and what are our public health officials doing to build capacity in the system for when that 28 days is up? That's the question I would ask.
So, Melissa, is the best advice to wash your hands and stay away from people who are strangers? And just hope for hell that's going to happen?
That seems to be the consistent advice, but that's the point. I think you've got to hear consistent advice, clear advice, and advice maybe from one communicator or message test. We know this. We know what message testing is. Why don't you test some good messages and see what sticks? Because right now, nothing's sticking.
So nothing is sticking. What about the impact of this and the public argument we had here on politics? I mean, is this going to diminish people's respect for politicians, their respect for their opinions?
So I think at the beginning of these crises, take doctors and frankly institutions, I think they had a high level of trust because they know about the virus or they knew the changing science around the virus.
Yes.
I think that's gone down now, and I think that politicians already started down here, and I think that it's frankly going lower because the advice is unclear, inconsistent, and nobody knows what to do.
Melissa, wash your hands. So I'm going to do the same thing. Thank you very, very much.
Thanks.
3 minutes. So thank you for watching. In response to many queries, I want you to know I don't always dress like Don Cherry. He dresses like me, sometimes. But seriously, we are going to continue to follow the stories that matter to you. The corruption in Ottawa, COVID, the response of officials to it, and what's going on with your taxpayers' money. If you like these stories, please subscribe. You can press the button, it's right up there. And my webpage is right down below here. It's free, and we are providing the service because we want to make sure that Canadians know what's going on.